Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Azam binti Abdul Aziz with matric number 1170265, and today I will present to you about the industrial training presentation. And before that, I would like to thank Dr. Sofina binti Tamam as my university supervisor and Dr. Alfa Rozana as my evaluator for this session. So we move on to the first slide. And for the introduction, I have undergone my 18 weeks of internship at Polyclinic dan Surgery Meditya, and it has been operated since July 2014 at Taman Tampur Indah, Johor Bahru, Johor. And the clinic is under management of Meditya Healthcare Group Sdn Bhd. The clinic was managed by the doctor in charge, which is the Dr. Abdul Azim Aziz bin Abdul Rani, and the organisation is consists of the CEO, 2 doctor in charge, and five of the staff. And this is the picture of the organisation. You can see that there's the picture of the staff and the CEO, which is Puan Farida binti Lamri, which is the mother of the doctor in charge, both the doctors, and this is the organisation chart of the clinics. So this clinic has a variety of services offered in the clinic to make sure that every patient has an amazing consultation and good medication. And the clinic operation hour is between 9 a.m. in the morning and until 10 p.m. Some example of the services offered at the clinic is wound care treatment, some basic family healthcare, X-ray, electrocardiogram, which is the ECG, and also the ultrasound. And at the clinic, I am assigned as the clinic radiographer intern, which is assisted by Puan Suhaila binti A. Rahman as the clinic radiographer. So some of the tasks that I have been accomplished and the activity that I have done throughout my internship program, many tasks and activities have been done, such as self-learning related to the study field, and some observation on the modalities available at the clinic, and also using and experimenting with the modalities. So on the part of the self-learning, I have doing my own research on X-ray positioning and anatomy, because this is the crucial part on being the radiographer. So it is very compulsory to make sure that every part of the human body that being shoot by the X-ray machine are the necessary parts and will not affect other organs and tissues. So I have been reading some specific books that have been used also at the clinic, which is the Elsevier's textbook of radiographic positioning and related anatomy by Kenneth Airborne Rager and John P. Lampignano. This author is the most famous one that related with the radiography field. So this is the picture of the book. And some of the study that I do is one of it is the chest X-ray, because chest X-ray is the most common one at the clinic, because mostly every week we have a procedure that involving the chest X-ray, because some patient is do it for medical checkup or something that related with cardiac disease. So when doing the chest X-ray, the patient have to be in erect position and facing the upright image receptor, and the superior aspect of the receptor is 5 cm above the shoulder joint. So we have to make sure that the shoulder is included inside the cassette of the film. So the patient's chins have to be raised to be out of the image field, and the shoulder are rotated anteriorly to allow the scapula to move laterally of the lung field. So we have to make sure that the scapula didn't get into the image, and the hands of the patient have been placed at the hips. at their back of their hips, and elbow partially flexed, rolling anterior towards the cassette. So their hands have to be at the front, so it will not get into the image of the lungs, just like the picture on the next slide. So the centering point is on the level of the seventh vertebrae. We have to measure it. It have to be at the center of the point, the collimation, and the collimation superiorly 5 cm above the shoulder joint to allow proper visualization of the upper airway, so we can get a perfect picture of chest X-ray. Next, at Polyclinic Dan Surgery Meditya, the type of X-ray machine that has been used since the day one is the Listom Rex 525. It is not a digital one, but it is enough to do the diagnosis at the clinic. And the X-ray machine has been used since the day one of the operation of the clinic. And also, the X-ray image are processed by the specific software to generate the COM5, which is the ScarStream software. So this type of software has been used at the clinic, and we can see the picture of the X-ray room at the clinic. Also the picture of the X-ray tube. And next slide is the picture of the ScarStream software in the radiographer room. So this is where we process the image, we edit it, use a different contrast and brightness. And also in the radiographer's room, content of the X-ray control panel, where we shoot the X-ray from that room, not directly in the not directly in the X-ray room. And basically, how does the X-ray machine works? The X-ray photons are created in the X-ray tube and are directed at the body part to be examined. So the X-ray are commonly produced in the X-ray tube by accelerating electrons through a potential difference and directing them into a target material. So when the electron move, they bump into each other. They also run into the glass of the tube and two special parts of the tube called the cathode and the anode one. So when the two atoms collide, this fast-phase electron bump into the tube's anode, and they will send off a type of light. This type of light, we call it the X radiation. And when the X-ray comes into our body, which is the tissue and the bone, they produce an image on a metal film, which is we call it as the cassette film at the clinic. And the soft tissues such as skins and organs cannot absorb the high energy rays, and the beam passes through them. But the dense material inside our bodies like bones, it absorbs the radiation, so it will produce an image. The X-ray film developed depending on which area were exposed to the X-ray. So the black areas on the X-ray represent area where the X-ray have been passed through, which is the soft tissue. But the white areas show where the denser tissues, such as bones, have absorbed the X-ray. So by that we can detect any fracture or hairline or fracture on the bones. So on the next slide, this is the real case that I have done during my internship. One of the example of the chest X-ray that I have been performed, and at the clinic, it required the patient to undergo a chest X-ray procedure to indicate cardiac disease, just like I have said before, or either is respiratory disease, suspected pulmonary embolism, and etc. So the patient also currently the X-ray chest has been used widely to monitor the post-COVID patient at our clinic. Yeah. And the patient is required to be in an erect position, standing position, and near to a standing X-ray. So the PA view is the standard frontal chest projection. Usually when performing a chest X-ray to a healthy person that can stand, we do it in a posterior-anterior projection because it is easier and have a clearer image. So the patient will require to hold their breath and follow the radiographer instruction during the procedure. This is the common one and the most important part because we want to have a clear image of the lungs. And once the patient hold their breath for some seconds, the radiographer will shoot the X-ray and the image will be generated, just like how I have put the image here. This is one of the result of the X-ray chest X-ray image. So throughout the internship program, I have gained a bunch of knowledge and skill required my field of study that most of the skills that I have didn't gain during my study in the university, because work field and study field is very different, and I have the ability to relate and practice the knowledge I have learned during the theoretical class with real life working situation as radiographer, because it also requires some skills that I need to bring from the theoretical class. And the industrial activity that have been done at the clinic enable me to develop a deeper understanding, relate to my study course, and enhance my knowledge about medical physics. So, but there are some challenges that I have been faced, because I'm aware that by having an internship at a medical clinic require me to know more about medical terms more than physics study. And I have been spend my time during the industrial training more on the duty as a frontliner, because we are in the pandemics, and I have been done my internship at the clinic. So obviously I have been part of the frontliner team, and rather than on how to implement the subject and knowledge that I have learned at the university, I have been part of a clinical organisation that require me to be one of the frontliner to fight the COVID-19 pandemics. So it is kind of difficult to adapt, but I have encouraged it. And most of other than that, if it involving the X-ray equipment, most of the equipment and machine used are modern, not the older one that we learn, that we have learned through the books, which is not the digital one. And so at the clinic it is the digital one, and it has its digital settings and did not require any calculation and formula. So we just have to click the button and the settings. So it has already refined the setting, like if the chest X-ray it's require 110 kVp, I just have to click the button and it has set. Not like the other machine that I have got the info that some government hospital of X-ray machine, they require to do the radiographer to do on the calculation and remember the own calculation, because there is no indication on the setting. So you have to know yourself the correct amount of kVp and the exposure. So that's some of the challenges that I have been faced. But to tackle the issues, I have been volunteering myself to take part with the job scope that did not involve any of my learning at the university, because I have never known about any medicine or any type of medicine to cure fever or cardiac disease, because there is a major part of the medical field. But as I have been an intern at the clinic, there is part of the requirement that I have to know and I have to learn at the clinic. So I have no issue to learn about that, because I think that every new knowledge is a priceless knowledge, and there is no such as of there is no such of unimportant knowledge. And as a conclusion, it is no doubt that I learn new things every day during my 18 weeks industrial training, and I have got a new experience and knowledges, also a better understanding of how physics and medical field is related. The objective of the industrial training are achieved where I can experience the off-campus work environment.